I mean, first day anatomy class, I knew that I wanted to be a surgeon. More than I didn't want to do pediatrics or gynecology or something. I wanted to do surgery. So I did general surgery first for 5 years, and I did plastic surgery training after that. I went to college in Atlanta, Georgia, at Morehouse College, and then I went to Howard University for medical school, which is in Washington, D.C. And then I moved back to New York for 5 years of my general surgery residency. And then continued up the East Coast to Boston for my plastic surgery fellowship at the Leahy Clinic. And then I decided that I've had enough of the cold in the Northeast, and I decided to come down to sunny Florida, here in Fort Lauderdale. I think that the benefit of working here is that there are a lot of highly trained, highly skilled surgeons, and in private practice it's normally one or two or maybe three doctors, but we have so many other doctors here that we can bounce ideas off of any problems that we arise. We have a lot of camaraderie, a very team-oriented aspect, and we all have our own specialties, that we can bring to the table. So I think in the early years, I learned a lot from my colleagues, and they also learned a lot from me, vice versa, which is one of the benefits of having so many people working here together. Sometimes we get a lot of what we call secondary or tertiary patients that have had, say, bad plastic surgery somewhere else that need fixing, which present unique challenges, and that's often good to get a couple of heads together to figure out the best options and the best ways to manage difficult patients. And then post-operatively it helps as well, because we're all very busy, we all have busy schedules, and we all carry a high workload, and sometimes I'll ask a colleague of mine to to cover for me, or vice versa, which is something that I wouldn't have if I was in a solo practice. Right. But I think the benefit of Strax is that we all get along great. It's very rare to get 19 egotistical the surgeons in the same room, and we all kind of get along, it's rare. But we have a very high level of camaraderie, and we can bounce. And for me personally, it's been great because I made a lot of good friends. Breast reduction, breast lift, augmentations, breast reconstruction. Do a lot of body sculpting type procedures, vaginal rejuvenation, butt augmentations, and the face. I do it all, basically head to toe, but I think I do a lot of African American rhinoplasty with African American noses, which can be a little bit more challenging because of their anatomy. And then everything else is kind of bread and butter. Facelifts, autoplasty, ear reductions, for young teenagers that have prominent ears, etc. But mostly I say body work, mostly breast, tummies. I don't know how it came about, but I've become kind of the resident expert in that somehow. The differences are the way the cartilages are underneath and the bony framework, and it's I do what's called an open rhinoplasty, which allows you to visualize the underlying structures, which is, I'd say, a newer way to do rhinoplasty. It's been around for a long time, but I think in training that's what a training program they're pushing more so nowadays is open rhinoplasty, so you can actually see the cartilage, see the bony framework, and know exactly, and be more precise in correcting it so that the overlying skin has the appearance that you want afterwards. It's a little bit more challenging. It takes a little bit longer, but I always say you can't put a shirt on your face, so you want to make sure that you get it right the first time. So it takes a little bit longer as far as the operation wise, but the patients all seem to be very happy afterwards. I mean, I'll do any nose, but it seems that I personally like the challenge of an African American nose. I think rhinoplasties it's a difficult operation, technically demanding operation. I mean, a millimeter can make a big difference. That much can make a big difference on a person's appearance. It's also important, not technically, but also personally. It's something that people can be very self-conscious about. They've been thinking about doing it for years, and they don't have the courage. They don't want to they don't want to look like Michael Jackson afterwards. They have a lot of, fears associated with it. So technically it's a challenging operation, but also it's a good opportunity for me to really get to know a patient. I think I know my rhinoplasty patients more than others because I spend so much time before the operation talking to them, counseling them, trying to make sure that they have realistic expectations of what they're going to look like afterwards, and so that they fully understand what's not only what I'm going to do during the operation, but what's going to happen post-operatively for the several months that it takes for all the swelling to go down and for them to heal properly. And I think that I like the challenge of rhinoplasty more so than anything else. I mean, technically it's demanding, but then also dealing with the patients before and after is also can be challenging afterwards as well. I think that I just try to be, just a real person when I talk to patients. I don't want, people. There's the technical aspect of surgery, but people are people, and people want to feel good about themselves. So there's the whole emotional aspect of surgery that sometimes gets lost. And I think that patients connect with me is that I think I'm a genuine person that doesn't, or that just can understand what a patient's feeling and what a patient's going through. And I think that, a good result as far as how you look is important, but a lot of what we do is psychological. A lot of what we do is how do you feel about yourself afterwards. And if you can try to make a patient feel good about themselves, that often does as much as having them have a fantastic, pair of breasts or a fantastic looking nose or a super flat stomach or in a small little waist. I think how they feel about themselves is equally as important as how they look. And if you can kind of tap into that and then show that you care, show that you're that you think about the psychological aspect of it or the mental aspect of it too, the emotional aspect of it too, then they seem to have a connection with you. So it's not, a person is not, it's not just a flesh and bone. I mean, there's a mind and a personality behind all of this that you have to try to connect with. I think it's not the case for me. I think that perception has to do with the volume of people that come in and out of these doors. And if you're looking at it from the outside, you see a lot of people coming in, you see a lot of people going out, and you don't really see what's going on in between. And what's going on in between, that they're individual, well-trained doctors that care about their patients, who take care of the patients. So we're a high volume place. I'm busy. I just left an operation. I'm about to go into another procedure, but personally, I treat all my patients with care and respect and as individuals, and I like the fact that we're busy. The economy's not great. We're just coming out of a recession, but somehow we stay as busy as any other practice in South Florida, maybe even the country. And I think we're able to stay busy because we take good care of our patients, and patients, they tell one friend, and they tell two friends, and tell three friends. It's kind of a self-perpetuating kind of cycle. And I think that I think that kind of it speaks for itself. The fact that we're busy is because we do good work, because we care about our patients, and people come back to see us. So I don't confuse the noise and the volume of the patients from just being one-on-one with my patients. So the perception is, I think, it's really from an outsider's perspective on it. But you speak to our patients, and the patients don't think that way. You speak to the doctors, and the doctors don't think that way. But maybe if you're not, I would say just come here, and see for yourself what it's like, and you'll see, and you'll meet, doctors that care about the patients. You'll speak to patients that have had great results and great experiences here.